Select Picture Audiometry. In Select Picture Audiometry, the patient is placed in a booth with or without earphones. The patient is asked to identify different pictures with the instructions given at different intensity levels. A threshold level for speech, which is the intensity level at which the patient responds correctly 50% of the time, is obtained. Electrocochleography. An electrode is placed through the tympanic membrane into the promontory of the inner ear. The ear is stimulated and recordings are made of the electrical response of the cochlear nerve. This can be done under local, topical, or general anesthesia. Hearing aid check, monaural. Binaural. The audiologist inspects the hearing aid and checks the battery. The aid is cleaned and the power and clarity are checked using a special stethoscope, which attaches to the hearing aid. Report 92,592 if a monaural hearing aid is checked and 92,593 if both hearing aids are checked. Electroacoustic evaluation for hearing aid, monaural. Binaural. A printout from a hearing aid analyzer is used to compare the electroacoustical characteristics of a monaural hearing aid with the specifications for that aid in 92,594 or a binaural hearing aid with specifications for that aid in 92,595. Ear protector attenuation measurements. This test can be performed in one of several ways. One method is to check the speech or pure tone threshold, which is the intensity at which the patient responds correctly 50% of the time, with and without ear protection, ear plugs or earphones, while the patient is in a soundproof booth. Evaluation of oral and pharyngeal swallowing function. The patient is evaluated to determine the oral and pharyngeal swallowing function. Assessment of the oral cavity includes the size, position, resting tone, range of motion and development of the tongue, lips, and palate. Palpation of the thyroid notch or cricoid arch with swallowing is used to determine elevation of the pharynx. Using a curved probe, sensation of the oral cavity may be assessed. An inventory of cranial nerves must also be included. Assessment of tinnitus includes pitch, loudness matching, and masking. The audiologist performs a tinnitus assessment including pitch, loudness, matching, and masking. Subjective tinnitus is an acoustic-like sensation, often described as a ringing sound located within the head, for which there is no external cause. Other descriptions of the sound include roaring, hissing, music, crickets, and static-like. A tinnitus assessment is performed to determine the exact nature of the acoustic sensation or sound. First, the pitch or frequency of the tinnitus is determined and then the loudness of the sensation or sound. The audiologist tries to reproduce or match the pitch and loudness using sound generators designed for this purpose. The masking process also uses sound generators to identify external sound stimuli that mask the tinnitus. Masking is a procedure that makes the tinnitus less distracting to the patient by use of a controlled noise that covers the noise of the tinnitus.